All right, time for your health check. A new report by the Robert Wood Johnson Foundation highlights high obesity rates among American children. So nationwide, more than 16% of kids ages 10 to 17 are considered obese. And in Texas, that number is higher, and this is maddening. More than 20% of kids here in Texas are obese. That is higher than the national average, and those most impacted are children from households with low incomes and children of color. So that's Hispanic, Black, and brown children, American Indian, Alaska Native young people, compared to white and Asian youth.
The choices people make are based on the choices people have. And we need to be putting forward supportive policy solutions, whether that's in the food and nutrition space, or in the housing space, or in the childcare space, or healthcare space, so that parents really have what they need to ensure that, or providers, I should say, of children have what they need to ensure that all kids can thrive and grow up healthy. And
You can read the full report for yourself. I've linked it for you at WFAA.com. And in case you missed it, I want you to listen up, because this may require a conversation with your cardiologist. That daily aspirin you've been taking may no longer be necessary. The U.S. Preventive Services Task Force updated its recommendations when it comes to aspirin use to prevent heart disease and stroke. Well, the panel now says, look, if you're over 60 and you do not have a history of heart disease, don't take daily aspirin.
All the other organizations out there have fallen in line with these recommendations. The American College of Cardiology, the American Heart Association, and a very strong message from the Food and Drug Administration that aspirin is not really indicated to prevent heart disease in people that don't already have it.
Cardiologist Stephen Nesson says while aspirin has been proven to be beneficial in some cases, evidence shows it can actually be harmful and even cause internal bleeding in other cases. So please do talk with your doctor before changing anything, of course. And by the way, when it comes to preventing heart disease, Dr. Nesson says it's important to get your blood pressure and cholesterol under control, eat healthy, and exercise. Greg, does that sound familiar? Do you know anyone who's ever suggested any of those things?
No, I don't. Doesn't sound familiar at all.
Doesn't sound. I never talk about that, do I?
No,
Maybe
no,
I
you
should
don't.
talk about that a little bit more.
or not. No, we hear about it. We hear about it plenty. All right, appreciate it.